This video is in reference to a new protocol, which is protocol 2.14, which is suspected intracranial hemorrhage alert, or ICH alert. Now, this is a new protocol and a new way that we're going to have to think about caring for our patients. And what it is it's identifying patients who are anticoagulated, who don't fit into our stroke criteria. So they're not hitting the Cincinnati pre-hospital stroke scale, and obviously not hitting the race scale. But there's concern for spontaneous intracranial hemorrhage. And this is on patients who are anticoagulated, on anticoagulants, not antiplatelet drugs. So anticoagulants, that term is used sort of interchangeably, but we want to make sure that we understand anticoagulants are medicines like Coumadin and warfarin. They're the same drug, Coumadin, warfarin, Eliquis, Pradaxa, Xarelto. So these are vitamin K antagonists, factor Xa inhibitors, and direct thrombin inhibitors. So Coumadin, warfarin, Eliquis, Pradaxa, Xarelto, not medicines like aspirin, Plavix, Effient, Brilinta. Those are antiplatelet medicines. So we're only including Coumadin, warfarin, Eliquis, Pradaxa, Xarelto. And the idea is to get these patients to the hospital as quickly as possible to get their head scanned and have these anticoagulant medicines reversed. Okay, so we're going to identify, first we're going to identify that the patient took an anticoagulant within the last 24 hours. And then we're going to identify symptoms that he or she may have that don't fit into the stroke alert protocol, so they don't fit into the Cincinnati pre-hospital stroke scale. Examples of symptoms may be sudden onset of severe headache, vertigo, which is when the room's spinning, ataxia, which is when the patient sort of wobbles around and doesn't walk normally, unexplained unresponsiveness, or any other neurologic symptom that you think maybe the patient has an acute intracranial hemorrhage that's spontaneous. Again, this is not from trauma. This is spontaneous intracranial hemorrhage in a patient that's an anticoagulant that he or she is taking in the last 24 hours. So first you'll identify that. Then what you'll do is you'll keep the head of the bed elevated. You'll transport to an ICH facility, which at the time of this recording is either SMH Venice or SMH Maine. You will notify the ICH facility of an ICH alert, and you'll please use the stroke sticker. As of right now, the only two hospitals that are ICH alert facilities that are using this process internally are SMH Sarasota and SMH Venice. And the idea is that they are working in collaboration, that they identify possible ICH patients that are anticoagulated. They have a process that they get the patient's head scanned very quickly. They have the proper medications in stock, and they have a pharmacist that's ready to give these medicines quickly. The hematoma that expands in intracranial hemorrhage patients that are anticoagulated is within the first 2 hours. So obviously we want to get these people reversed very, very quickly. I can go in detail about the reversal agents in a different video, but I just wanted to make sure we have an understanding of the protocol for these spontaneous, non-traumatic intracranial hemorrhage, suspected intracranial hemorrhage patients. This is a new alert, and dispatch is aware of it. We're going to call on the radio ICH alert, and they're going to notify the hospital just like they do a stroke alert or a trauma alert or a STEMI alert to get the resources mobilized, to get the medicines ready, and to get the head scanned quickly. Thank you.